Each member is acknowledging that they are attending the meeting via Zoom and that they are located in Wayne County, Michigan, unless otherwise stated when I call your name. Commissioner Marecki?
Here.
Commissioner Dobb?
Here.
Commissioner Anderson?
Present.
Commissioner Colleen?
Right here.
Chair Baker McCormick?
Here.
You have a quorum present.
Next item.
B, Chairwoman's remarks.
I have none today. Next item.
C, approval of the March 23rd, 2021 meeting minutes.
So moved.
Support. Colleen.
Been moved and supported. All those in favor?
Aye.
Aye.
Any opposed? If not, the motion pass. Next item.
D, unfinished business. There is none listed.
Next item.
Item 1, under new business, update from Dr. Mohamed Hamami regarding COVID-19.
Good afternoon, Dr. Hamami.
Good afternoon, Madam Chair. Thank you. If I may give the report, I'm going to share a very short PowerPoint. Can you see my screen?
Yes,
Indeed,
we can.
yep.
Thank
Excellent.
you.
Thank you. So as usual, and I do apologize for missing the last meeting. I was out of the country on some family matters. A lot has changed, unfortunately, since I spoke with the committee, specifically in the number of cases that we have seen rising. And of course, it is not only Wayne County, it is across the state of Michigan and to some degree across the country. But we have seen almost a 50% increase in the confirmed cases from the week prior. Fortunately, that trend is not mirrored by the number of deaths. In fact, the number of deaths is plateauing and even going down, which probably is an indicative of the vaccine working in preventing severe cases as well as in preventing hospitalization and death. Most of the cases we are seeing are now mostly in younger population. I believe the mode for this week was about 27 years of age, which is that population that still has not been vaccinated. We are seeing less and less of positive cases in the groups that have been vaccinated, i.e. the 50 and over, which again proves that the vaccine is working and also is something that is encouraging for everybody to get vaccinated when the vaccine is available for them. Our 14-day trend, if you recall, a couple of weeks ago, I showed you the same graph that is pointing downwards. Unfortunately, this is now going upwards. There has been 254 cases increase from 2 weeks ago. Again, this is indicative of more cases that we are seeing in the county as well as in the state. The top 10 communities with 10 or more cases are still relatively the same. The percentage of distribution of the number, what percentage of cases in the county are within the same ranges that we have seen in the past, but we are seeing more, as you can see, in terms of the absolute numbers. Just for example, last week Dearborn was close to 350, now it's almost 600, and that is also the same for all those communities that since the beginning of the pandemic, we have been seeing the usual players as those with more cases. Our positivity rate has increased tremendously as well. I think the last time I came in front of the committee, it was in the 6%. As of yesterday, it is 18.3% in Wayne County and 15.5% in the state of Michigan. Ideally, you would like to see it below 5%. And again, this is reflective of the number of cases that we're seeing. Some of the school-related cases, again, we are seeing almost now, as you can see, in the past, when I used to report these, you would see cases both in students and in staff. The majority that we have seen in the past few weeks are amongst students. That probably is a good indication that our teachers that have been vaccinated are probably protected, and now it is more on the students. In terms of the variants that we hear a lot about, the B117, that is the UK variant, our numbers have been the most in Wayne County of this variant. We have the most amongst all other variants, 130 confirmed cases, varying from the top in Dearborn, Canton, Livonia, and Dearborn Heights, and then several cases in each of the communities listed. A new variant is now has been discovered in Wayne County, the B1429, that is the California variant, and we have so far 3 confirmed variant cases in Canton, Livonia, and Northville, 1 case each. Our vaccine inventory continues to improve. We have so far since December received almost 214,000 doses of all kinds of vaccines, including first and second doses. We have administered close to 120,000 and redistributed almost 34,000 of the doses. And by redistribution, again, we are giving it to those that are COVID-19 certified, that are helping us in vaccinating our community residents. For example, Livonia Fire Department, Dearborn Fire Department, and others that are certified by the state and by the CDC. This is what the Michigan Department of Health and Human Services priority matrix it looks like as of today. It was updated back in March of 12th. The only difference is that in April 4th, the state declared that we will move to phase 2. That means everybody that is 16 and above will be included in the vaccination plan. However, still the priority groups such as the seniors and agriculture and food processing workers are still considered a priority. And as you can see, those green bars mean that we would still focus on those. This is a quick snapshot as of last week. All the senior community vaccination efforts that we have done. If you recall, we started that in the last week of February. And so far, we have been almost to every community in Wayne County with a total of close to 42,000 seniors that have been vaccinated. We are currently in the Grosse Pointes and Grosse Ile this week, vaccinating seniors 50 and over, as well as those with underlying conditions. This is our matrix for priority phases as Wayne County. Some of the updates are now we are including those that are 16 and over with disabilities and pre-existing conditions. And we plan to start our phase 2 of 16 to 49 years of age as directed by the state this week. This will coincide with the launch of a call center that we are partnering with THAW to handle a call center. There will be an announcement within the next day or two of an 800 number that our residents can call and request for appointments. However, these scheduling appointments are going to still follow the social vulnerability index. We are focusing on those communities that are most vulnerable to start with based on appointments availability as well as vaccine availability. And this is how we are going to move down the line as our call center becomes more and more active. We're still focusing on our 2 current locations, which are Schoolcraft Community College and Wayne County Community College. And we are looking for more locations as we go down the road and expanding our capacity so we can accommodate everybody.
Great, thank you for that report. Is there a way you can send this, the report to all of the commissioners?
Yes, certainly, I will do so.
And a question as to testing. Is testing still on the rise? Are people still coming in for testing? What does that look like?
It hasn't decreased, yet it didn't increase as much. We still have the testing capacity and capabilities. Those county-sponsored testing sites are still up and running and functioning. Most of the testing we are seeing for people that either are traveling prior to traveling or coming back from traveling, and there are certain groups such as athletes or people that are engaging in activities that demand testing, that we're seeing that. However, I think it is still very important to continue to do testing, especially with the rise of the variants that we are seeing.
Okay. And the locations for testing are?
They are on our website. I'll be more than happy to provide the committee as well with an updated list.
Okay, it's the same though,
Yes.
that we had before. Okay.
Yes, yes.
All right, and I'll open up questions for commissioners. Commissioner Dodd.
Thank you, Madam Chair. So I have a couple of questions for Dr. Hamami. So the social vulnerability index communities, I completely understand that we need to get them vaccines first, and they do need to be prioritized. But however, I've noticed that a lot of those communities are geographically, sorry, I cannot talk to you today. They're closer, they're located to the Ford Field mass vaccination site. And you know, I represent Plymouth Canton. We're out here in the western side of the county. We're not one of those high social vulnerability communities. Is there any way to work around that so that maybe we can get a couple more vaccination sites out here to maybe to like spread them out throughout the county so that they're not all located in one area? Because I mean, people out here just, I don't think they want to drive all the way downtown to Ford Field to get a vaccine. It would just be so much more convenient if we could have something in Canton or even, you know, Wesley and Livonia.
Absolutely, Commissioner, and I see Ms. Allen joined in. I'm sure she can chime in. Our plan isn't dependent on Ford Field only. As you know, we have been, since the beginning, we have had locations that are more centrally out Wayne County, Schoolcraft and Livonia, as well as Wayne County Community College in Taylor. Our plan going forward is to have several extra locations, what we call pods, that are more at the four corners of the county, if you want to say so, and they will accommodate also the needs. Although we know that the Ford Field operation is very beneficial in addressing those that are mostly vulnerable, but also those that are most vulnerable do not have the means to go down to Ford Field. Hence, we engaged with FEMA in our remote vaccination locations that were very beneficial in bringing vaccine to those underserved communities. The social vulnerability index is not a deterrent. It is more that we are going to be addressing those communities until we are at capacity. So let's take, for example, the city of Ecorse, which is at the highest SVI. If after 2 days of filling all the appointments, we start seeing there are no more or less residents from Ecorse, then immediately we'll jump to the community after and after. So this is how I guess the operation is going to evolve. Ms. Allen, I don't know if you want to add anything to that.
Hi, good afternoon. Janelle Allen, Chief Operating Officer. And Dr. Hamami, you did hit the points. I did want to emphasize as well that I actually had the opportunity to serve on the Unified Command Center for the FEMA project. And as Dr. Hamami said, that their driving factor is that they wanted us to go and vaccinate in communities, targeted communities. And they really wanted us to look at our communities that had the highest social vulnerability index based on the criteria that we use from the CDC, but also they used a census tract index where some of their numbers were, our communities were aligned about which were most vulnerable, but that is where then they were willing to send their staff, if you will, out into the communities. However, as Dr. Hamami said, that Ford Field is open to everyone. And so they really were trying to get to those communities that probably had more barriers to trying to get to Ford Field, or had barriers or lack of access just community-wide and county-wide. So that's why those sites were selected for the actual the staff to go there, because they actually have the highest social vulnerability index in Wayne County.
Okay. I do want to I always like to plug this, but Canton is willing to be a location if you're looking for more locations. Canton at the summit, we're very eager to help out. So then I just have two more questions. Now that we're vaccinating ages 16 and up, if someone who is 16 or under 18, 16 to 18, do they need to have a parent with them when they come to get vaccinated?
That is something that we're still looking into. I know that the state has made some exceptions for the consent process. We still haven't got a final decision on that. Just a reminder that 16 is only for the Pfizer vaccine, and both the Moderna and J&J are 18 and above.
Oh, okay. So, okay, got it. I didn't know that. Thank you. Okay, so we're just still waiting on the consent for parents.
Yes.
Okay, and then my final question is, I've received a couple emails from my constituents about Ramadan. And I actually meant to reach out to Commissioner Beydoun about this, but I haven't had time. And I don't know if receiving a vaccine during fasting hours is allowed during Ramadan. I know I'm pronouncing that wrong, I'm sorry. Is that allowed, or do we need to set up some sort of clinics that are operating after dusk?
That's a very good question that we're also working with some of our Muslim communities in ensuring that we are accommodating both. I know personally from my discussion with some of the scholars, since it is a medicine, it's an injection, it's not taken by mouth, it doesn't break fast. Some more strict scholars might say, yes, you have to wait until after sunset. If there is a need, I know that our Dearborn centers are going to have some extended hours, such as in Access and Dearborn Fire Department. If there is a need for us to accommodate some of those as well, then we will consider that.
Okay. All right, great. Thank you. That's all I had. Thank you, Madam Chair.
Thank you, Commissioner Dodd. Any other commissioners? Looks like Commissioner Killeen.
Well, Anderson was first.
Okay, well, we'll
Yeah.
take Commissioner
Yeah, I came in
Anderson.
after him. Yep.
Thank you.
Okay.
Thank you. A couple of questions, Dr. Hamami. I know there was some information out that Meyer is now vaccinating at all their locations. Previously, they'd only had certain locations. And I've just wondered if there's any locations that's been added in the last few weeks, because I believe I heard that a lot of the drugstores are now getting vaccine. And I wondered if you could update us on that, and if the website, maybe the county website, could even be updated for people.
Yes, Commissioner. Unfortunately, I'm not as up to date because of my absence the last 2 weeks, but I know that the state has expanded their federal pharmacy program, and they included more. And I believe that is going to add to more options for people to get it from retail pharmacies and others. I will look into that and provide, if there are any updated locations, and check our website. I will look into that and provide you with some answers.
Okay, and is the Dearborn location still operational? I thought I heard you say that it was. At the Dearborn Performing Arts Center?
I believe the fire department is receiving some doses directly from the state, as well as Access health center are receiving doses directly from the state. To what frequency they are holding those, I don't have the information, but I believe they have that as well.
And I know there's some folks that, as was touched on a few minutes ago, that have younger family members that are between 16 and 18 that would like to get the J&J. Is there a way that we can find out where those locations are and how they can specifically try to go to those locations? My grandson's one of them, and my daughter's trying to find a place to get all three of them vaccinated at the same time.
Right. So the Pfizer is the only one that is 16 and over. Yes. The J&J and Moderna are 18 and over.
Yeah. So it's Pfizer.
Yes.
Yeah. Okay. All right. Thanks for clarifying that. But is there, if someone wants just the one shot deal, is there a place that they can specifically go to that would have the J&J? They only want to make the one trip. I have a neighbor that's like that. They want to make the one trip.
Yeah, the short answer is yes. It all again depends on what is the flavor of the week that you are receiving. If you're receiving J&J, then you have it. If you do not, then you don't. We are working on, again, we have been always consistent in having a Pfizer clinic and a Moderna clinic. We are looking more into redistributing some of the J&J that we have to some of our partners. We did give Dearborn, for example, in the past several weeks, more J&J. We did arrange for Livonia to have more J&J. So it all depends on what they have left in their inventory or not.
Okay. And last question, senior living facilities, where we stand on those. I received a call from someone gathering information about the senior living facilities in my district, and just wondered if we have any idea of how long it's going to be before that will be operational to get those into senior towers and that.
Yeah, I believe that the update that I got upon my return that we have covered almost all of those senior living facilities, either through our own nurses or through our partnerships with the EMSs and EMTs. There might be one or two that are still left to be scheduled. Either my colleagues Jennifer Floyd or Lisa Davis can weigh into that just on the update on how many are left, but they are still part of our focus on that. In addition, we are now starting to focus on the homebound population. There will be a appointment system in place as well that we will start addressing that as we go along.
All right. Thank you. Thank you, Madam Chair.
Thank you, Commissioner Anderson. Commissioner Killeen.
Thank you very much, Madam Chair. A couple of comments, Doc, on testing. We got to keep that up because that's our early warning for where outbreaks are occurring, and it allows our public health professionals to be more on top of where outbreaks are occurring rather than reacting to them after people start showing up in the hospital. And I'm also going to encourage you to hang tough on the misunderstood SVI. It's the way to do it. I wish more people would familiarize themselves really with what that tool is so that we can talk to our constituents about it. By the way, it's going great out in Grosse Pointe today. Beautiful operation. You guys are doing a great job.
Thank you, sir.
Okay, we have a glut almost in the last couple of weeks. We got vaccine places opening all over the place, right? And now we got FEMA in town. Doc, to help me and maybe other folks, see, I'm not sure what the county is getting involved in. I don't know if some of our vaccines are going over to Ford Field or what the deal is. Dr. Hamami, is it possible to get like and you have other partnerships too, that we got so many vaccines, 10,000 of them, right? And we used whatever, this week, 8,000 in what we're doing out in communities. We're in a partnership with FEMA, so 5,000 is going over to Ford Field, or just to kind of track that, because it's hard to explain out to the public too, you know, what all these different things are, and what the county involvement is in them. So I don't know if that's possible, but you know, I'd love to see when we get our weekly allocations, where does the county go with that? I'm not arguing that we shouldn't have partners out there. We got to take care of people as best we can. Is something like that possible, Dr. Hamami?
Absolutely, sir. Just to simply answer your question, the FEMA operation is completely independent of the vaccine allocations that we are getting from the state. This is mostly a federal effort that came with its own vaccine supply. So we are not supplementing any of those that are happening in Ford Field or even in the communities where we are.
Yeah, if you could, go ahead.
Our vaccine allocation is still coming to Wayne County as the health department. The only redistribution that we are doing is with entities such as Livonia Fire Department or Dearborn Fire Department, or some of the healthcare providers, the FQHCs or others that are, again, certified. They have a need, they serve the communities that we have as a priority. And this is where there is a clear and process of what constitutes a redistribution, where we reallocate some of the doses that we're getting to those entities.
And I support that, Dr. Hamami. If you could share that though with us, because, and I'm glad I'm right on the money with Ford Field. Everybody wants to know about that. And it's like, hey, that's the feds and they make their own rules, right? Not something, and I try not to influence the rules in the county either, right? I think we're on the right track for what we're doing. But we keep changing every day, and I don't think that's helpful. You mentioned the FQHCs. What do we know, and this will be the last thing I'll ask about today. What do we know about the American Recovery money? Certainly, you've alluded to this earlier, that the people that need the vaccine the most are kind of the hardest to reach. We have to get right into communities because we can't count on people being able to make it from the east side a couple of times down to Cobo or down to Ford Field or any of that kind of stuff that we need. And I think the president has spoken to this, that we need more of a strategy of vaccinating right in neighborhoods so people don't have to go far. So do we know or have a glimmer right now how the American Recovery Act is going to be able to help us to do that?
Unfortunately, sir, I don't have enough details. I know while I was away, I've read that HRSA has dedicated some funds for community health centers to boost their vaccine capacity. I don't have the full scope of where these funds and how they can be used, but I can certainly provide an update next time.
Well, I'm sure you will, yeah, because, you know, Congress appropriates 1.9 trillion, and 2 minutes later, everybody's got their hands out and trying to get at that money. So I will be curious as we go. I know it's going to up our effort in the county to some level, but I am much concerned that we actually reach directly into some of our hardest hit communities to get people. And I think we're showing that, aren't we, Doctor, in the data that the poor communities have lower vaccination rates?
Yes.
Yeah. So, okay. So whatever we can do there, I'm all in favor of, as opposed to these big ones that we're trying to drive people to these centers. All in favor, and I'll be interested to hear more about having more community local ones. Thanks for your work, Doc. Thank you, Madam Chair.
Thank you.
Madam Chair, to that point, may I say something?
Yes, go right ahead, Commissioner Marecki.
Thank you. In Ways and Means today, Khalil and the consulting group gave us an overall picture of the $339 million we're going to be getting from the government, and the committee of the whole next week will be talking about this. They're not sure exactly what the qualifications are to use the money. They're just kind of waiting for that to come in. But it's already starting to roll out on how they're going to start splitting it up and wanting ideas on what to do with it, just so you know, Commissioner Kleen.
Thank you.
Thank you, Commissioner Marecki and Commissioner Kleen. Are there any other questions from commissioners? All right, if there are no other questions, thank you again, Dr. Hamami, and we look forward to your next report in a couple weeks. Thank you.
Thank you, Madam Chair.
Next item, Madam Clerk.
Item 2, a presentation by GrowthWorks Inc. and Ccmo Center for Youth and Families on their function as care management organizations.
And so we have someone from GrowthWorks on.
I'm here, Madam Chair.
All right. And can you introduce yourself for the record? Thank you.
I will. Yeah, my name is Nick Griswold, and I'm the Chief Executive Officer of GrowthWorks. And we operate the Western Wayne CMO, which we'll talk about in a little bit. I'm going to share my screen.
Thank you.
If that's okay.
Yes. Yep, here you go.
Wow, worked the first time. My lucky day. Thank you, Madam Chair, for the opportunity to come and speak to this subcommittee today. I'm really grateful for it. It's my first time. I've been with GrowthWorks 4 years now, and it's the first time to come and sort of formally talk about our agency. And so I really appreciate that. I also have Jennifer Seibel with me. She's the program manager for the CMO. She's going to talk a little more specifically about the CMO. I'm going to talk a little more broadly about the agency. In I think every email I received, we were asked to be brief. So I have taken that to heart. This will be a rather quick presentation. If there are questions, of course, we'll be happy to answer them. So just to give you an idea, GrowthWorks, this is our mission. Our core values are listed here. Our mission is to help individuals restore hope, embrace change, and improve their lives. Restore hope has taken on a whole new unexpected meaning these last 13 months. It has really broadened our mission, and it's been a challenging time for all. And human service organizations are no exception, and the clients that they serve. Just to give you an idea, GrowthWorks at a glance, we were founded in 1971 as a youth drop-in center to create a safe environment for youth to be active in our community. Shortly after, though, we formalized some treatment and counseling programs because we realized that even back then, kids were struggling with things that maybe a lot of the other adults around us didn't recognize. Some things we didn't even have names and titles for back then. And so we formed counseling and treatment programs rather early. The CMO and our treatment programs currently hold the gold seal of approval by the Joint Commission Accreditation of Healthcare Organizations. We consider that to be the gold standard. Most hospitals, other healthcare organizations, behavioral healthcare organizations are accredited by the Joint Commission, and that's no different here at GrowthWorks. We serve about 2,000 clients and their families a year. We're offering programs in youth assistance, family service, chemical dependency, peer recovery coaching. Something that I'm especially proud of is several members of our board of directors, including our current president and vice president, are former clients of the agency when they were kids. And a lot of our other board members are parents of kids that we've served. And I think that really keeps us grounded and connected into why we're here. And so it's very helpful. GrowthWorks really serves in sort of three main discipline areas: juvenile justice services, which includes the CMO, but also youth assistance programming for a lot of the communities in Western Wayne County. We provide pretty comprehensive chemical dependency services, including outpatient and residential service for both adolescents and adults. And then one of the more recent programs that we're very proud of is we have a partnership with the Conference of Western Wayne, St. Mary Mercy, Livonia, and many area police departments to do emergency peer coaching. And we dispatch a peer coach 24/7, 365 to either police departments or the hospital. And about as fast as you can get a pizza delivered, we will be there. We try to shoot for 60 minutes or less, and to just really start counseling that individual right away. So we're pretty proud of that program. And then the third bucket you see is just all of our family assessment, support, and education. We have embedded social workers in a school district in Western Wayne County. We offer very comprehensive family therapy, reunification. We also have a partnership with Third Circuit Friend of the Court, where we provide supervised visitation to parents in a safe environment. And I wanted to share those with you also because the second and third column serve the CMO in the first column. So we have clients that are being served by many elements of all these that are CMO clients. Western Wayne CMO overview. I'm going to let Jen come in and talk in just a second, a little more about the CMO and specifically our CMO. I did list, and I have emailed this presentation just recently though, so I apologize for that, but you can go back and reference it afterwards. The easiest way to think of our service area is essentially the conference of Western Wayne's catchment area. We work very closely with the conference, and you can see that the communities that are remunerated here sort of reflect that. Jen, you want to tell us about more specifically about the CMO?
Sure. Hi, everyone. My name is Jennifer Seibel, and I am a program manager with the CMO and have been here for 20 years. And yeah, just on this slide here, we speak to some of our unique service entities and components within the CMO. So the first one being restorative practices connected to balanced and restorative justice. And that is held in our community team meetings. So each of the communities that Nick just shown, we have a meeting each month that includes our staff along with community stakeholders, school resource officers, police officers, and we connect our clients to that meeting as a form of balance and restorative justice and restorative practices. And we've had that since the inception of the CMO. As Nick talked about, our family services, we're able to utilize some of our other departments to provide services for our families. So we treat the family, not just the client, and that lists several of our programs that we offer for our families when their son or daughter are involved in the CMO. Most recently, one of the things we're really proud of is we've developed some mentoring programs for our clients. We have both a group girls program, a boys group program, and then also individual mentoring. Currently, we strive to keep our case managers at 15, which is under the requirements by the Child Care Fund. And we do that with the goal of providing intensive case management for all the clients and families that we serve. Another unique quality is how we are embedded in residential care to create specialized programming. We actually have several projects where our actual therapists from our agency are embedded in juvenile justice residential programming to create that specialized programming. We regularly utilize a care path model in hopes of reducing length of stay, promoting structured decision-making. And that's really the idea of looking at the client from a treatment perspective and not a confinement perspective as far as treatment, and looking for those root causes and addressing those root causes of their behavior. And then we also most recently added 3 in-house tutors to aid in the academic concerns our clients may have, and particularly in response to the recent increase in truancy issues and cases that we were seeing over the past 2 years. And then we also have a group home that is a recent, well, not recent, we've had it for quite some time, but it's one of those other unique aspects we have to provide an alternative to residential for our clients. And lastly, one of the other components I think is really something I'm proud to speak of within our department is that we have our management team and our case managers are trauma certified as of 2019. So in response to the increase in the developmental trauma we see in our clients, the trauma within family systems, we felt it was best to do that to be able to provide the best services for our clients and families.
All right, thanks, Jen. Just moving right along here, just a couple more slides to show you. Whoops, sorry. I thought I'd bring just a couple quick data points that provide just a little bit of a snapshot for the last couple of years. So the first one is the CAFAS. If you don't know what the CAFAS is, I included a very small blurb down at the bottom. It's a small font, I apologize for that. But it's an assessment that we and the other CMOs give to our clients on a periodic basis. And it assesses them across multiple domains, and the domains are listed in the paragraph. But behavior towards others, self-harm, mood, substance use, thinking, homeschool community. It's a pretty comprehensive assessment, and it's validated by studies and all that kind of stuff. And so anyway, we can give it over time and we can see what their progress is. So I just pulled the numbers just for this year, but we have, of the youth we've discharged so far, 47 of those youth have seen an increase in their CAFAS score, or a decrease in their CAFAS score, which is a good thing. It's like golf. The lower score is better here. And so they've seen a decrease in that score over time. And then you can see here kind of how that shakes out. And the note I had was that 39 of those youth had at least a 40% reduction in their CAFAS score over the time that they were involved in the CMO. And the last slide, and I wanted to bring this up because I had a chance to go back and watch the meeting from this committee's meeting from 2 weeks ago, and a couple things that Black Family Development mentioned, specifically Jane Fernandez, that I wanted to just reiterate is, you know, she talked a bit about recidivism and what it was like in the county prior to the creation of the CMO program, and she quoted a number was 33%. And she talked about the amount of money basically that has saved the county. And I'm an accountant, just like Jane. I'm an accountant by trade, and so I can certainly appreciate that. It also made me wonder how many lives have been changed over the course of that same amount of time. If recidivism has dropped that much, basically by 2/3, what has that done to the kids that come through our doors? And so just a little specific bit, these two charts are just mostly about recidivism for our agency, and you can see that we're just well under the 33%. We run recidivism in the single digits, and we consider that a real point of pride of the program. And that's all we have, Madam Chair. I guess the last thing I would want to say, if I can have 30 seconds, is just to say, so I'm new to this. I've been here 4 years. Like I said, I was a public school administrator before I came to GrowthWorks, and the CMO program is we really have something special here. I don't know if maybe because it's been so long that we don't talk about it a lot, or maybe because it's working rather well, we don't talk about it a lot, but it's a really remarkable public-private partnership that shows what government and local agencies like ours and the other 4 CMOs can do when we collaborate together. I mean, Jane talked about how much money the county has saved over time. I think the results speak for itself in terms of what we've done for the residents of the county. And I just wanted to take the opportunity to say thank you for that. And thank you for Wayne County for the foresight and the commitment to this program all these years. I think it's really been incredible. And I'll be glad to take any questions if there are any.
Well, thank you so much for your presentation. Do we have any questions from commissioners? Any questions?
I would just like to thank Nick for coming, and Jennifer. They do an awesome job. They've got a great reputation. So thank you for doing this. And so nice and concise.
Yes, it's so good to understand and know exactly where each CMO stands and what they're doing and how it impacts our young people and also the bottom line for Wayne County. So I thank you so much for attending today. And we do have a question from Commissioner Anderson. Go right ahead.
It was more just a comment than anything else. I wanted to thank them for what they're doing. Nick is, we go back quite a few years when he was with the South Redford School District, and did a fantastic job there. And he and his team are doing a great job at GrowthWorks, and I appreciate it very much.
Thank you, Commissioner. All right, are there any other comments or questions? If there's no other questions, then we will move to the next item. Thank you again, Nick and Jennifer, for attending today.
Thank you so much for the opportunity.
Thank you.
We really appreciate it.
All right.
Are we moving to item 2, or was there a second part of the presentation?
Yes, from the Center for Youth and Families.
Yes.
Do we have a representative here today?
Yes, Alicia Light.
Okay. I'm sorry, can you Can you state your name and title for
Sure.
us?
Alicia Light,
Mhm.
Lyte, and Chief Executive Officer of Central Care Management Organization, Center for Youth and Family.
All right. Thank you, because your name doesn't pop up here for some reason. Well, thank you so much for attending our meeting today. You can go right ahead with your presentation.
Great. Thank you so much, Madam Chair. Again, my name is Alicia Light. I am Chief Executive Officer of Ccmo. I just started my 16th year with the agency, where I started out in 2005 as a case manager. Ccmo is one of 5 care management organizations responsible for the care of youth in Wayne County. We are definitely committed to providing an integrated service delivery system for adjudicated probationary Wayne County youth that results in positive outcomes for our youth, their families, and also for the communities we serve. The services are designed to strengthen community safety, to provide an array of treatment and prevention services to both empower the youth as well as the families to make positive changes and choices in their lives, resulting hopefully in safer communities and also stronger families. Ccmo now has been in business since 1999. We were founded by Ennis Center for Children as well as Spectrum Human Services. Since 2008, we have been COA accredited. As of yesterday, I received great news that we did pass our 2021 reaccreditation. Also, Ccmo provides services to our catchment area would be Central Detroit, Highland Park, and Hamtramck. The youth and families residing in this service catchment area are at special risk and have challenges exacerbated by both poverty and urban decay. We are dedicated to providing family-centered case management services founded on a strength-based philosophy. Our role is anywhere from that of being a teacher, a partner, and we're definitely dedicated to providing support and advocacy for our clients while teaching empowerment towards independence. Around 2007, Ccmo incorporated a doing business as name, which included Center for Youth and Families, which for us was very crucial to help our communities identify with our agency that we do provide services for youth and families. We definitely take great pride in lending help and hope to youth in need. And what better joy than to help others, as it truly takes a village. Ccmo offers many different programs. We initiated an in-school suspension program where we had 10 years of sponsorship with a resource room within a few different area high schools as well as middle schools to maintain youth, to provide tutorial services, life skills, so students could remain in the school versus being suspended and removed from, the school setting and either sitting at home or, further involvement or any involvement in any criminal activity. This concept has now been taken over by Detroit Public Schools, and it's been a part of their curriculum now probably since 2018. Ccmo also has expanded services in-house where we do have a youth assistance program, which provides individual and group settings, life skills, educational supports, tutorial services, meals, as well as with successful completion, there's also where our youth will receive incentives, as well as there's also a graduation ceremony in their honor. We have additional programs, which will be our violence prevention, which is serviced within Vineland Academy, where there are law enforcement officers who facilitate groups to encourage open dialogue between both the youth and law enforcement. Also, we have a substance abuse trauma program that is within Detroit School of Arts. And that program is about a 36-week program, which also offers specific assistance. We also have Detroit Rescue Mission Ministries, where there is a teen mom program, which provides community-based teen mothers with necessary resources and interventions to assist with motherhood. We did partner recently with a workforce development partnership program through Detroit Employment Solutions Corporation, where it's only for Detroit youth only. However, with this Check and Connect mentoring, there's also apprenticeship, there's life skills, entrepreneurship, and things like that. We also offer a few more community-based programs, which would be our SafeNet program. This is for ages 11 to 19 years old, for community-based youth who engage in sexually abusive or any inappropriate behavior. This can be anywhere from a 9 to 12 month community-based intensive therapeutic service program. There's also a substance abuse assessment and treatment program. We also have a growing art program, which is also a therapeutic program to help you to increase self-esteem and improve any academic performance as well. They also do, I guess, recording their own music. There's some photography as well. Painting, self-expression through journaling. There's just a few more programs. There's our critical thinking program, which encourages more positive life choices for our youth to both problem solve and think before reacting. There's also a tutoring and literacy and math program. We also have incorporated a male responsibility group, where with this, our young men are learning goal setting, their social interaction, life skill, and also lifestyle choices as well, peer interactions. And more recently, we did incorporate a female empowerment group to help with self-esteem and body image, social media. And then there's two more programs that we did incorporate, which would be a financial literacy program. And I am very happy to hear that with having this, just as, we as adults, this program is centered around youth to encourage them at such a young age to learn key financial principles of maintaining a good credit score, of learning how to save money, to have a savings plan, even at such a young age. And then lastly, a fan favorite program of ours is a culinary arts program. This program is facilitated by a professional chef for our community-based youth to, I guess, for them to actually learn different or have a different job opportunity as far as learning in the food service industry. And with that, they learn proper utilization of cooking utensils, food handling, and they also receive their food handler's card as well. And so that is just a few of the different programs that we do offer. We are definitely trying to keep our young people involved in extracurricular activities. And if you need us, again, our name is Central Care Management Organization, Center for Youth and Families. We're actually located in New Center 1 building in Suite 370. That's it for my presentation. Thank you so much for having me.
Thank you, Ms. Light. Wow, you have a lot of different programs going on. And so can students or parents just sign up? How do they get involved in your programs?
Yes, it would probably be better to contact our direct phone number. And yes, it is open to students. It's open to the community. It's open to, area people within our catchment area as well. And so our phone number is 313-875-2092. You can just let us know, why you're calling. And so if there's more youth that want to join any of the programs, by all means, please do so.
And if you have a brochure,
I
if you
sure
can
do.
send that over, and then we can get it to our commissioners.
Absolutely.
All right. And have you seen your numbers increase because of COVID? And what have you had to change to deal with that increase, if so?
Well, the numbers have changed differently. I think we have more youth now not placed in residential settings, which is good. So there's more of an increase in the community settings. And that's why we're trying to wrap so many different services around them and to try to keep them, more occupied. So it's a good thing. As far as any increase in criminal activity, not necessarily. And so again, just trying to be as optimistic as possible with, everyone is staying masked up and socially distancing. We hope that that's the case. But we also had to look at engaging our youth in a different manner as far as more of the virtual learning. And so we've also incorporated that into a different program within our agency to monitor, to mentor, to also provide tutorial assistance. And we do have a couple different teachers that are also assigned to help us with the tutorial aspect as well too. So it's just been busier times, I think, definitely for all of us. But again, as much engagement as we can possibly provide to our youth, this is what we're in business for.
All right. Well, thank you again. Any commissioners have questions? No questions? All right. Well, thank you, Ms. Light, for coming to our meeting today. We look forward to receiving your additional information.
Thank you so much.
Right. Thank you. Madam Clerk, we'll move to the next item.
Item 3, communication from Health, Human, and Veteran Services Department, Public Health Division, forwarding notification of an emergency procurement contract with Bay Promo.
Okay, you know what? Let's take a motion to discuss the 3 through 6.
I'll move that to receive and file.
Yes, and to discuss.
Yep. and
Right.
discuss.
Okay.
Yep.
Is it supported? Did we get support?
Or
Thank you. All right, so item number 3. Are there any questions from commissioners?
Madam Chair.
Yes. Go
Um,
right ahead. I'm sorry, I didn't see your
Thank
hand.
you. That's okay. On a number of these items, they're being done under the emergency procurement of our procurement ordinance. Could somebody from commission staff remind us what the rules of the road are around emergency procurements? Do they all have to be RFP'd? What are the rules of the road that brings them to us today as a receive and file item?
Through the chair, this is Felicia.
Go right ahead.
So Commissioner Clean, the procurement ordinance allows the administration to make procurements for health and safety and other urgent needs as emergency procurements without commission approval. The procurement ordinance requires that those items be submitted as receive and file or informational to the commission within 30 days. So these are being submitted pursuant to the procurement ordinance. They were initially entered into pursuant to the procurement ordinance. The procurement ordinance does not provide any specific detail with regards to any particular rules related to emergency procurements. As you know, we've had these discussions before, but these are being submitted for informational purpose pursuant to the ordinance.
I have one other question, Madam Chair, for our council. When the administration uses emergency procurement, do they have to submit a letter specifying why this falls under emergency procurement as opposed to a regular procurement?
Off the top of my head, I don't believe that the ordinance specifically says they have to justify why. The cover letters may or may not give some explanation. Sometimes they do, sometimes they don't. I would say that there is no uniformity because there is no specific requirement related to that.
Gotcha. Thank you. Thank you, Madam Chair.
Thank you, Commissioner Colleen. Any other questions from commissioners on item 3? Okay, item 4. Any questions? Commissioners? Okay. I do have a concern actually for 3 and 4. These are emergency procurements. However, one of these items did actually go through a bidding process, but the other did not. And then our commission counsel just indicated that there was a 30-day rule on when we were supposed to get these items. Is there a reason why, first, that these are out of state and or out of the county contractors that we're working with? Just wondering if there's anyone in Michigan at all that could have secured. These are for masks, and then the number 4 is for marketing. Can we have someone talk about these 2 contracts?
Hi, this is Carol Osterberry from the Health Department. And yes, as far as the masks, I know that, when we were working with all of this and, working to get masks, there were a lot of other entities, we were, I think, having a hard time finding vendors that even had the capacity to be able to provide us with the number of masks we needed here in Wayne County, because it was such a large number. So, that was, I think, why they had to go out and, seek out, vendors that were not, here in Wayne County. And the number 4, that is they're in Farmington Hills. I'm not sure if that is in the Wayne County, what part of Farmington Hills. So that one is in Michigan. And as it was explained, yeah, this has all been done in accordance with the procurement of the emergency procurement, the procurement ordinance, in accordance with the emergency procurement, statute and steps that we have to take. It's all been done in accordance with the procurement director, Aaron Wagner.
Okay. The commission counsel just said something. Felicia, didn't you mention 30 days? I'm just looking at the dates. Yeah.
Yes. So the procurement ordinance requires that the administration submit them to the commission within 30 days. I don't know if all of these were submitted within 30 days, but I will tell you that some of them have been delayed just because my office particularly was short staffed, and because these had already occurred, we prioritize action items. So some of these items were from last year, but some of it was due to the fact that I just didn't have the staffing to review them. Trying to get, again, the action items done versus items that have already occurred for receiving and filing. So that's the reason that some of these are delayed, though, again, I can't tell you that they met the 30-day deadline because they often do not. But I mean, I think that if you look at some of the analysis, just like we talked about in COPS earlier, there simply isn't a clear system as to how these are being processed. Some of them are not being signed by the CEO. Some of them don't have clear terms and dates within them. I mean, there's just a myriad of issues with the emergency procurements in general. that we've noticed across several committees. And these are included in that. You also mentioned that one of them was RFP. We have seen a few of those. It's not clear why something would be RFP, sent out to bid, sometimes evaluated, and then still processed as an emergency procurement. So we have seen that a few times, but again, because there are no specific rules or restrictions or guidance within the ordinance itself, I can't say that the administration and procurement are not allowed to do it. It's just things that this committee and the commission as a whole should note. So if you do want to put those restrictions or requirements or get some clarification regarding this process, we can move forward, hopefully in the future, and do so.
Yes, thank you, Ms. Johnson, for that. I do think we need to put together some resolution to talk to the process, especially where it comes to the contracts where we're not soliciting, or maybe we did solicit, I don't know, Wayne County businesses. I think especially right now, because businesses are hurting in Wayne County, that we need to really focus on Wayne County businesses and those that are disadvantaged. And this contract for marketing, I'm just not sure why we couldn't find a Wayne County business for that. All right, so any questions on item 3 or 4 from commissioners? All right, we'll move to number 5. Any questions, concerns?
Did you want to vote on the first?
No, we're taking them all together.
Oh, okay. Oh, okay. Yes, yes.
Yep.
Okay.
Yep.
Madam Chair, this is Janelle Allen.
Yes.
May I just comment on your remark too about there being a concern and a focus on Wayne County businesses, and just share with you that County Executive Evans absolutely shares that goal and that perspective. And I know that we have an internal team and an initiative in looking at to make sure that we are utilizing Wayne County-based businesses to the maximum extent possible, and including, as you say, even other businesses that are in targeted groups, if you will. So I did want to share that, and I do know that there is an internal focus now on how we can make sure that we are spending the maximum amount of Wayne County dollars with our businesses.
Thank you, Ms. Allen, for that. Yes, because it's really important, especially now, because businesses are hurting. Okay. Any on number 6? I think we're on number 6 now. Any questions, concerns? All right. If there are no objections, then we will move to receive and file all of the items 3 through 6. Next item, please.
We need a vote.
Well, this was the discussion on the items, and if there is no objections, then we don't need to vote.
Yes,
Yes, we do, Madam
Yes,
Chair.
we do. Yeah.
On the items that we just discussed?
Yeah.
Yes,
To
ma'am.
receive and file.
And there's a motion on the floor to receive and file.
Okay. There's been a motion to move and file. Was there support?
Yes, we got a motion and support.
Okay. All those in favor?
Aye.
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 Any opposed? If none, motion passed. Next item.
Item 7 on the addenda, requesting commission approval of a grant agreement with the Michigan Department of Health and Human Services.
All right, item D7 and
Move approval.
both items 7 and 8. We can take them together. Looks like they're receive and file.
I'll move approval.
These are approvals.
Okay. They're not receive and file. Okay, so it's been moved and Is it support for item number 7?
Support.
It's been moved and supported. All those in favor?
Aye.
Madam Chair, we
You
gonna
had
have
a-
a discussion?
Go right ahead, Commissioner Colleen.
Thank you, Madam Chair. So items 7 and 8 together is about $4 million in a grant from the state of Michigan. COVID Michigan immunizations supplement. The description says it's intended to support local health department driven COVID vaccination events. Is this how we are paying for going out to all of the communities in Wayne County and using this money? And is there anything additional that we're using this money for besides running our own local events like the one today in my district?
Hi, yes, this is Carol Osterberry, Health Officer for the Public Health Division. And yes, that's exactly as you described, those are the allowable costs, the cost for, the staff, cost for the medical supplies, cost for we aren't having to pay rent. So, but all of those expenses that are associated with the COVID-19 vaccination efforts, events, yes.
Okay. Then my follow-up question is, 4 million is a lot of money.
Oh, wait, 6.82 or 682,000. Where's the 4 million?
Yeah, but
Oh,
the next
okay,
one
down
has
below.
the-
Got it. Yes.
The next one
Okay.
has the same description, right?
Yes. Yes, they do.
So I can't imagine we've dropped 4 million on our Highland Park, on our Livonia, on our so is some of this money part of the, and I don't want to get ahead of ourselves here, Carol, and start putting stuff out there, but I know conversations are going on about continuing events in the community beyond going around this time. Is this what this money is going to be able to support theoretically?
Right, theoretically, and a big part of this money also to support additional medical approved staff to actually administer those vaccines, gearing up for, thousands of vaccines being administered every day in Wayne County, then having enough, staff to be administering all those is very important. So that is a big part of, this 3.4 million that we are, have budgeted for. Yes.
That's great. And we're bringing on these people as like contract? Not
Because
full-time.
this money ends, they will have to come on as contract employees. Yes.
Yeah. Okay, good. And how many people are we at? This is great. How many people are we adding?
Well, for each
More or less.
site, yeah, more or less, we're looking at between every bit of 50 to 60 people.
Yeah. Thank you. Thank you, Madam Chair.
To that point, Madam Chair, may I say?
Go right ahead, Commissioner Moretti.
Thank you. Carol, I asked this last week, I think it was of Huey Newsome. Is there any consideration, like Livonia, even though we gave them all the vaccines, they did all the vaccinations. Would any of that money cover their staff? I mean, there was a lot of volunteers, but I'm talking about like the firefighters that were working overtime, I think most of them doing this. Would any of that money be able to go to Livonia, and Dearborn did the same thing to pay for their overtime?
Right, that's a good question. We would certainly have to ask back to the state about allowable costs and expenses.
Okay, and I know that he mentioned, because wait, I'm looking at this. Are these actually FEMA monies?
This is not.
Okay, because there's going to be FEMA monies coming in for vaccination as well, right?
Correct, and it's more that the FEMA money is what we're looking at more for those expenses that you're talking about.
Oh, okay, all right. So you're still looking into it?
Right, we are.
Okay, thank you.
We, the ultimate, we will be maximizing all of this money is my point.
Okay, thank you. Thanks, Madam Chair.
To that point,
Go ahead,
Madam Chair.
Commissioner.
Carol, I just had a quick question. How many of the employees that are used at the different vaccinations are people that we've hired on a temporary basis? And are Is the commission going to be furnished a list of who those employees are? Who we had to pay, not the ones that are volunteers, certainly.
Right. We have on, our public health team, and staff, public health nurses, 13 public health nurses. And as I said, we're gearing up, we're doing thousands of vaccines a day. So yes, then we have had to hire on more and are continuing to hire on, more contract staff. So, if indeed the commission wanted a roster of employees, we can provide that.
How were they hired? I guess is the question I have too, is how were they hired?
Right. We actually work with Semha for hiring.
Okay. So all the employees did come from there, all those that were paid?
Yeah, yes. If they are Semha employee, they are paid, yes.
Okay. All right. Thank you.
Mm-hmm.
This is Janelle Allen again, if I may just supplement that response. That going forward, and I think which Commissioner Killeen was asking about how many employees are we hiring for what purpose. At our two stationary sites now, the one is Schoolcraft College in Livonia and the Wayne County Community College District in Taylor, we have been able to administer the max has been about 2,000 a day. And that was with a lot of support from the National Guard. We expect the National Guard to go away. Plus, we want to get to a point where we have sufficient vaccine supply that we are vaccinating the maximum amount we can in those facilities. That would be closer to 3,000 a day. That's where we're going to really need to enhance our staffing. Right now, what we're looking at is going to actual staffing agencies that provide medical staff, people who are qualified to vaccinate. So instead of using Semha is a standing contract that we have that actually help staff a number of the public health programs. And because they're tied to grant funding, they are considered temporary, if you will, because if the grant funding goes away, the position goes away. These are now these real short-term or shorter term where we just need people who can vaccinate. So that is the plan, the approach we're taking going forward. That will be going, so they won't be our employees. They won't even be contractors. We'll be contracting, I believe, with these companies to make sure that we have qualified people who can vaccinate. And again, that's in anticipation of us having sufficient supply of vaccine to administer 3,000 doses a day at each site. So really 6,000 a day just at those two sites. And some of this funding here will be used for that additional staffing.
Beautiful.
All right. Any other commissioners have any other questions?
Madam Chair, was the motion for item 7 or 7 and 8?
For 7.
Okay, thanks.
So it's been moved and supported. All those in favor for item number 7?
Aye.
Aye.
Any opposed?
I think we have to take roll call on that because it's not a receive and file, I believe.
Correct.
I don't know. Felicia, is it required to do roll call or?
Yeah, so we need to just make sure that the vote is clear. That's why we normally do roll call, because these are action items.
Okay, so yes or no? Did we need to do roll call? It's clear that no one is opposing. Do we need to do roll call? Hello?
Commissioner, can you hear me?
I can now. Mm-hmm.
Okay, so the normal practice is to do a roll call so that it's clear to everyone in the public how everyone votes, because that is what the law requires to make sure that the votes are clear. So that's why you'll find in committees that for action items, we tend to do roll call votes so that it's clear to everyone how everyone is voting.
Okay, so we'll do a roll call.
Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Anderson,
Yes.
Commissioner Killeen,
Aye.
Chair Baker McCormick.
Yes. Motion pass. Next item.
Item 8, requesting commission approval of a grant agreement with the Michigan Department of Health and Human Services.
Madam Chair, I'd like to move this item for approval.
Is there support?
I'll support. Dobb.
It's been moved and supported. Any discussion? Any more discussion? If none, we will take a vote.
Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Anderson,
Yes.
Commissioner Killeen,
Aye.
Chair Baker McCormick.
Yes. Motion passed. Next item, please.
Item 9, requesting commission approval of the appointment of Melito Jordan to the position of Director for the Health, Human, and Veteran Services Department.
Is there a motion?
We have the new director with, or the new proposed director with us.
Yes, we do. And I'd like to actually introduce her, but I didn't know. Is it okay if I
Go
proceed?
right ahead,
Okay.
Ms. Allen. You can introduce her and then we'll do the vote, okay?
Okay, wonderful. Yes, Ms. Melito Jordan is on with us, and it is an absolute pleasure to present her to serve as our next Director of the Health, Human, and Veteran Services Department. I believe you should have her very extensive curricular vitae and resume, which displays her extensive experience. She has practical experience, policy experience, operational, and academic experience. She started her career in midwifery, where she was delivering babies. She served as an advanced practice nurse and delivered, I believe she said, close to, if not more than 1,000 babies. And while on the front line, she realized that there were significant issues with access to care for some pregnant mothers, as well as other marginalized populations. And that moved her and motivated her to move to the policy side, where she could effectuate change. When she moved to the policy side, she started in Pennsylvania, and she served as the director of the Bureau of Family Health with the Pennsylvania Health Department. She served there, I believe, for 7 years. And then she moved over to the New Jersey Department of Health, where she was a senior executive service with the Division of Community Health, which again got her connected directly with day-to-day issues, health issues that impact the underserved population, marginalized populations, those most in need. She's also taught at the college and university level, and she's even a published author. And bundled with this wealth of experience, she also brings superior leadership skills, where she has shown that she is a natural mentor and a coach. She also is a visionary who's able to take a vision and make it a reality. She knows how to develop sound action plans, how to implement, how to monitor, have accountability, as well as how to budget accordingly. And with this, she brings, and she showed this every time that we spoke with her, a genuine passion for improving health outcomes for marginalized and underserved populations. She went through a very rigorous interview process. She actually participated on 4 different panels, so she ultimately interviewed with over 20 different individuals. These panels were comprised of her peer department directors, direct reports, as well as our cabinet members. And through this, it was unanimous from every person who met her that she was the person for us. So then the question became, are we for her? And I don't think I've ever met a candidate during any of my roles, either Wayne County and outside of Wayne County, who spent and invested as much due diligence as she did in evaluating, was this the position for her? She took it upon herself to come to Michigan to visit, and she spent several days here. She met individually with each of who would be her direct reports. She came with a very prepared agenda, a very prepared list of questions. She had asked for information in advance as well as afterwards. Also, while she was here, recognizing the critical role that we play in providing medical services to people who are in our jail and the juvenile detention facility, she actually even toured the jail medical operations. Again, as she knows that that's a critical part of the operation. After going through all of this, we had extensive, very extensive conversations about what we see are the strengths, the weaknesses, what are the priorities. And I would tell you that short of her being here, that I really tried to show her in the most candid way, the good, the bad, and the ugly with regard to where we are today. And I would tell you that after I have had, you all probably know that I have been carrying the responsibilities of the director of this department after our last director resigned. And if you recall, he resigned last January before we knew of COVID. And at that time, I thought that we knew that our department, our division directors, no one had expressed interest in the role. So I thought it was best to leave them in their roles and not to disrupt any of their day-to-day operations by putting one of them as an interim director when no one had expressed interest in even applying for the role. So I thought it would be a great opportunity for me to get even more involved in the front line with the department, again, not knowing that COVID was right around the corner. This last year, I would tell you, has been one of my most challenging and probably one of the years that I've grown the most as a leader, as a frontline worker, and as a public servant. And it gave me the unique opportunity to see what do I think is best, what type of leader we need to have a transformative change when we get through this pandemic and to help us get through this pandemic. I can say that I have not ever met a candidate in any of my roles that I think is best suited for what is needed right now. With that, I'm going to ask Ms. Jordan then to share with you just briefly, why does she think this role is for her? As I've always said, that we know she's for us. The question is, why are we for her? So Ms. Jordan.
Good afternoon, everyone. Madam Chair and the esteemed
Good afternoon.
of the commission. I'd like to thank you for inviting me to be here today. It is absolutely an honor to be presented. In addition to, for your consideration to review not only my educational background, but also my experiences, and particularly at this very challenging time, I would say, in the United States, but more importantly, in Michigan itself, and particularly in Wayne County. As none of us, as Ms. Allen said, none of us was anticipating over a year ago that we would be involved with a pandemic in this country. And so this is a very unique opportunity. It's a very humbling opportunity at this point, I say, to even be considered and to have made it this far. So I thank you for inviting me here today. Just in brief, I will say that I began my career as a director of the Bureau of Family Health in Pennsylvania, more than, I guess in 2012, and it was to oversee all the maternal child health for the state of Pennsylvania. I was previously, prior to that, as she mentioned, I was an advanced practice nurse in maternal child health. I am an expert in that. I was tapped very early on in my career by the National Institutes of Health to investigate and to publish an article around the high cesarean section rates in the United States. That was an absolute honor to be part of that. And then from there, we went on to talk about the United States in terms of antenatal testing. And so we've come a very, very long, long way. I have spent time, as she's mentioned, also as a professor at Drexel University. I also have taught at the University of Pennsylvania in the medical school with residents in PG 1, 2, 3, and working alongside chief residents as well. And so I've had a very interesting career, always dedicated to serving women and families, and particularly those of the underserved. Health equity and health racial equity, as well as concerns have been one of the things that I have worked on for a very long time in my career. So again, it's an honor to be here today in terms of looking at this position and being considered, and of course, seeking your approval. And so I will stop there and allow you to ask me questions and get a chance to get a better gauge of who I am and what I bring to the table.
Well, thank you for that. It's very nice meeting you. And my question is, if you are now are you in Pennsylvania?
Yes, I'm in Morgantown, Pennsylvania.
Pennsylvania. So when will you be coming to Michigan?
Well, I was just there about 10 days ago. I was there for about 4 or 5 days, and I did have the opportunity to really view the entire, at least all of the Detroit area. And then I did go out to far as the Grosse Pointe area as well. And I looked at all of the areas in Grosse Pointe Farms and Grosse Pointe Park and the shore. It was just absolutely beautiful. and got a chance to spend time at the stores and ate at the restaurants outside. And so I really find, again, absolutely beautiful. I had never been to Michigan before. I've been to many other states, but I had never been to Michigan. But I will tell you, very fond of the Motown sound. So clearly I know all of the many songs or singers that have come out of Michigan. And so that has certainly been a pleasure. I am looking, once I am approved by all of you, hopefully to be there by May 3rd.
May 3rd.
May 3rd. So I'm beginning to pack already. So I am preparing all of my furniture and working with the movers to get me out there. So I do plan to be on board on May 3rd.
Great. Well, if we can do anything to make your move and your transition a little bit smoother, please reach out to us. Looks like Commissioner Killeen has a question.
Thank you,
Good
Madam
afternoon,
Chair.
Commissioner Killeen.
Pardon me?
Good afternoon.
Hey, good afternoon, Ms. Jordan. Not only do we get to know you a little bit better, you get to know us a little bit better.
Yes, yes.
Because you're going to have to come back asking for stuff. I've gone through your resume, Ms.
Yes.
Jordan, great resume. What I would like, and this is kind of bottom line for me, and you've alluded to this before, not to go on forever and ever, but I would like to hear your comments on two related concepts in health. And those would be the social determinants of health and the disparities in healthcare. I'd like to hear you talk about that a little bit, because it's a bottom line for me.
Sure, absolutely. And it's a bottom line for me as well. My entire career has been in actually addressing social determinants of health. I trained in Jackson, Mississippi during the time, of course, of racial unrest. In addition to that, I've had the opportunity to address social issues such as bad housing, address issues of poverty, tobacco abuse, issues around lack of access to care, in addition to racism, in addition to unemployment. And so with all those things being front and center, and not only in Mississippi, which had the highest infant mortality rate in the country when I was there, and I was sent there by the United States government to help address that particular issue. I have moved that into, when I went to Philadelphia, I am a Philly girl. Of course, your teams have beat our Sixers as well as our Eagles many times, but we've come back also, I think, pretty strong and beat you guys a couple of times as well. But with that being said, in Philadelphia, I was hired by a Pennsylvania hospital to serve to individuals within the clinic setting. So I spent most of my time at a place, Health District 4, which primarily was a Latina community, and Health District 6, which was primarily a Black community. Those women would be dropped off early in the morning at Pennsylvania Hospital, which is the nation's first hospital. And so I gave them my card. I made up a little 3x5 card with my phone number on it. And so they were able to call me when they went into labor. I would go onto the labor floor and I would sit with them all day until they gave birth. In addition to that, I would follow them up afterwards for preconceptual care as well as family planning services, and also in terms of making sure they got on the WIC program, and hopefully help them try to space their pregnancies in the future. I provided a food pantry for them as well so that we could educate women how to take care of their babies. And so that was very important, and I carried that eventually into policy. I moved that as well. I went to Vineland, New Jersey, which is the egg capital of the world. And actually I spent time in Vineland. It is a very wealthy, wealthy county. However, it is a very poor county. It has lots of immigrant population there. And again, was able to provide private care services and develop the midwifery service there at the Newcomb Hospital and serve those women as well. So I've pretty much dedicated myself most of my career. I did the same thing at Temple University. I was at Temple and started a nurse midwifery program for adolescents there. It was the first university who took in pregnant women that could go to school and finish their high school education and then return and graduate with their classes. So I hope that helps.
Yeah. No, thank you. You're going to have ample opportunity here in Wayne County to exercise. One other thing that I'd like you to briefly comment on, because it's been so misunderstood and bandied around in the press. In your career as a public health professional, how useful have you found the social vulnerability index in terms of a tool for public health?
I think it has been, a useful tool in public health in terms of looking at the vulnerability index, but also I oftentimes think that it can be misused as well. So I do think that it's important that we look at the information very carefully, consider some of the perhaps what I call flaws that's in it, but also to be unbiased in how we interpret the information that we're receiving from using it.
Thank you. I think that's a great point of view. Thank you, Madam Chair.
Thank you, Commissioner Colleen. Commissioner Anderson.
Good afternoon, Commissioner.
Thank you, Madam. Good afternoon. I'm very impressed with your resume. I guess the flaws that you just touched on, what have you determined that those are?
Well, I can't say all. I would say that oftentimes when we look at an index and we look at, again, social determinants of health, we are focusing on specific areas. And I would say that just because an individual has come from a low socioeconomic community and or we're looking at undereducation and or we're looking at the perhaps hopelessness or stress, or even the fact that an individual have come from a neighborhood or a zip code that doesn't have road and or circle instead of street behind its name, we tend to sometimes put them in certain categories. I have issues with that because I was one of those children who grew up in a zip code that did not have, or on a street that did not have road or circle. And so I was a teen parent. However, it is because of the background that I have and the wonderful mother that I had that allowed me to achieve heights that I never thought that I could achieve. And so I do think that there are opportunities, there are people that will mentor you along the way. And it doesn't mean because we come from a certain area that they're not gems within the community. And so I do believe strongly that we can't always look at just what's on paper and then decide that this is what this person's life will be. That we all have a trajectory that can be changed based on the relationships that we have and the mentorship that we receive from others.
Beautiful response. Beautiful. I couldn't agree more. The other questions I have was actually, I guess if Janelle probably could answer these. Janelle, from a historical perspective or some way to view this, what were the previous directors' salaries, the previous two directors?
I believe that after the department was merged, that the salary was $138,000. And then the next salary was $150,000.
Okay. And I understand the factor of qualifications, certainly considering, this Mrs. Jordan's qualifications, certainly play a big part in it. And I did notice something in some of the paperwork about 35 hours. Is that what is going to be in her contract?
Not at all. There's no contract. This is an at-will appointment. I'm not sure to what you're referring if you say 35 hours.
Yeah, I think it might have been on her resume, I think is what I saw the number 35. I thought it was number 35 hours. And I thought that was unusual because I know when you're in a position like that, there's going to be days that you're going to probably put in 12-hour days. And
I have put in very, very long hours. I get the job done.
I would expect that. Yeah, thank you. Thank you.
If anything, we've discussed about making sure that there's work-life balance and that we don't let this job just be so consuming. So there was never a concern about putting in enough time. It's more that making sure that you do have that other balance as part of her life.
Yeah, I would think that based on her resume and her past experience, she would be hard pressed to only put in 35 hours. But I saw it and it just sort of popped out.
With all due
that-
respect, she's invested 35 hours in 1 week, just her due diligence in this job.
Yeah. So, and relocation allowance, I don't think that's that big of a deal. I don't know if we've ever paid that before, but it's not a big deal. But I welcome her, and I look forward to working with you, Mrs. Jordan, and I'm really respect your responses.
Thank you.
Thank you.
Look forward to working with you.
Thank you.
Thank you.
Commissioner Dow?
Yes, thank you, Madam Chair. I just wanted to say that I am super impressed that you went above and beyond to research not only Wayne County, but that you came here and checked it out. And you'd be surprised how many people I have interviewed in my career who have not researched the job that they're applying for. So that to me is, something that is so impressive, and that you went like to that above and beyond to do that is wonderful. And I'm very impressed by your resume.
Thank you.
Just wanted to ask just one quick thing. Have you been involved in any COVID related stuff in Pennsylvania?
I actually was very much a part of the rollout in New Jersey in my role as the Senior Executive Service Director. When it hit a year ago, Governor Murphy actually put a shelter in place on March the 11th. And so therefore did work with my staff as well with stakeholders in terms of continuing all of the grant agreements that we had with the Centers for Disease Control and United States Department of Agriculture, as well as the United States Food and Drug Administration in terms of the grants and agreements that we had to move forward. So we moved a lot of things online with Zoom, but we still had to meet the obligations of cooperative agreements. Work with staff, and as you can imagine, it was an adjustment initially for everyone. I will recall when we first got started, Hoboken was one of our very large case counts in terms of individuals being positive. And so I remember the health commissioner asked would people volunteer to go out. And so I was ready to go. The Hoboken is about 2 hours from where I live. So the first person I called was my daughter. And I spoke with my daughter about going. And my daughter says, Mom, I'd really rather you not go, because you're sort of in that group where you probably shouldn't be out there doing that. You probably want some of those younger public health folks to be out there on that. And we, as you can imagine, I heard someone say earlier, I think it was Carol, we were very short, light. Michigan probably was initially with not having PPE. And so therefore it was somewhat of a challenge. But then my daughter said, Mom, call your best girlfriends. So I have a girlfriend who works at CDC, of course, in Atlanta, and she's a neonatologist. And I called her, and she's like, I'm not going. You shouldn't go either. And so we laughed about that, but I was ready to suit up and go. So the goal was to perhaps stay inside of the Department of Health and work from there. So I did the call center. I literally reached out to hundreds of individuals that was willing to volunteer. The governor had asked us to put together a roster of people that we could put out and be on the ground to start. And so, yes, I, from that point forward, got involved in the policy pieces, got involved in making sure that we could provide the research to the governor to make decisions around the nursing homes. And so I'm very familiar with all of the things and challenges that New Jersey faced, as well as Pennsylvania, because I lived in Pennsylvania, and still working with the on vaccinations in terms of rollout. You had mentioned earlier about rural areas. Again, I actually live in a rural area. And so recognizing that it has been very spotty for people who live in small counties to get the services. FEMA did come into Philadelphia, but you had to be a Philadelphia resident in order to be tested there or receive the vaccine. However, in places like Berks County, places in Dauphin County, again, people didn't have that opportunity. So I did mobilize the community in which I live in, reached out to the county clerk to find out what they were going to do in this county for the individuals that live here, and worked with the Pennsylvania's Department of Health to make sure that we could get people vaccinated. So
Right.
for yes.
Okay, and I totally would have told my mom the same thing. Don't go, don't go out there. Stay in your home and do something from home. So, okay, well, I appreciate your answer and thank you very much.
You're more than welcome.
Commissioner Marecki.
Thank you, Madam Chair. And it's so nice to meet you. I'm so glad you could spend time with the committee today. I have a sister who's a nurse midwife, so I know what some of that entails. But just hearing the excitement, and it sounds like the relief in Janelle's voice, right there, you've got my vote, because she's been working her body off for the last year so hard. I mean, she answers, you can call her at 10 at night, she'll text you an answer, or she'll text back. So just the fact that Janelle thinks so highly of you, your resume is wonderful. And I'm really glad that you want to move to Michigan and the Detroit area. For years, the joke was always like, why do people want to come to Detroit? And things have changed so much in Detroit. And this is a great state. You're going to enjoy going up north and seeing other areas in the state. It's a large state. So I'm just happy that you want to come here. And we're going to get someone that's so qualified. And again, just Janelle's presentation of you, you've got my vote huge.
So are you moving? Are you making the motion?
Oh, yes, I'd love to make the motion. Thank you.
All right. Is there support?
Celine supports.
Oh, I'm sorry, Terry, were you finished?
Yes, yeah, I'm finished.
Okay.
Thank you.
All right, thank you. So it's been moved and supported. Any other discussion, comments? All right, then let's take a roll call vote.
Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Anderson,
Yes.
Commissioner Killeen,
Aye.
Chair Baker McCormick.
Yes. So the motion passed, and welcome to our new director, Ms. Jordan.
Thank you. Thank you very much. Thank you.
Thank you.
Thank you. And if I may say, though, as Commissioner Marecki knows, is this somewhat a relief for me? Firstly, yes, but that's probably the least important to me. It truly is. I think that we're at such a transformative time in Wayne County that I've talked to even Mr. Evans about this, that when he first came into office, the focus had to be on the finances. And that I think he's put together, done a yeoman's job about getting us steady financial footing, as well as having very sound fiscal prudence. It is now time to focus on our operational side. And on the ops side, you must focus on our human capital. And it is time that we have got to start investing resources to shore up and build where we can start having a more meaningful impact on outcomes. And what I convinced them in the healthcare arena, that's where we can begin. We know we have to fix our bridges and roads. We have to be there to help our people grow and improve. And I do think Ms. Jordan is the best way we can start that path of how we need to bring in the type of talent and even nurture and retain our current talent to get the outcomes that we all want for the good of our citizens.
Yep, very good.
Yes, thank you.
Thank you all for your support.
Mm-hmm. All right, so Madam Clerk, we can move to the next item.
F, such other matters as may be properly submitted before the committee.
I don't believe there are any other matters. Next item, please.
Public comments.
Can you unmute everyone? Any public comments? Does anyone have any public comments? Is everyone unmuted?
Yes, the lines have been unmuted.
Okay, and do we have any emails?
No, we don't have any emails.
Great. And last call for public comments. Looks like we have no public comments. Next item, please.
Adjournment.
Is there a motion? There's
Oh,
been a motion
Anderson.
and support. It's been moved and supported. Meeting adjourned. Thank you so much. Have a good rest of
Thank
your
you, Madam
day.
Chair.
Bye-bye.
Thank
All
you,
right, thank you.
Thank you.